Today I am reading from the book Spirit of Homeopathy, book written by Dr. Rajan Shankaran, philosophy part, and chapter number 15, concomitant. Throughout the proving, a drug produces a number of symptoms, sensations and modalities in different parts of the body. It does this quite permanently within a few minutes, hours or day. When the symptoms are produced, further administration of the drug is stopped and pathology is not allowed to develop it. It is obvious therefore that the symptoms are not due to the pathology but a functional disturbance of nervous system. For example, the dyspnea of carbo-vegetable is not due to the left ventricular failure in the proving, but it is purely nervous phenomenon. Due to our knowledge of pathology, we interrupt these symptoms in a particular way and then attribute location to remedies. For example, cactus produce constrictions in the chest, and so we assume that it must have action on the heart, producing ischemic disease or angina pectoris. This is assumption is not logical. We know that the cactus in proving was not proved to a point of producing a pathology. So, this constriction pain is a nervous phenomenon, and it is we who assume that it is a heart pathology. Similarly, the bearing down sensation of the sepia is nervous sensation and not due to the prolapse of the uterus. I am quite sure that the provers of the sepia did not get a prolapse in a few days. So we see that the characteristic symptom of the remedy are purely nervous sensation, but we have classified them into the organ and the pathology. I suggest that the symptom become more important when we cannot find any organic basis or pathological explanation for them, and when they occur as a concomitants to or independence of the pathology. These symptoms will then guide us in the selection of the correct remedy. When taking a case, we have to look out for such symptoms which are purely due to the nervous phenomenon and are in no way connected with the main pathology. A remedy which produces such phenomenon on proving should be very closely examined. In a case of angina pectoris, the constrictions pain alone may not indicate the remedy, but if the patient has ineffectual urge to stool with this pain, this will be very important indications. If we understand this concept, then symptoms will have different meaning for us. For example, the spotty pain of Kali bichromicum will not indicate that it is a remedy solely for the peptic ulcer, but we can see it in a condition where such a pain is uncommon or characteristic. The most important advantage of this idea is that it directs us to so-called small or less used remedy, which are often considered as a local one. The local symptoms will now be open to much wider interpretation, and this remedy will be used as deep acting and not merely a local acting one. For example, Berberis vulgaris, which has pain radiating from one point, has been used almost exclusively in the renal problem. We may find great utility for this remedy where such pain are concomitant to some other condition without the patients having any renal or urinary calculus. Other example of such symptoms are constriction of cardiac end of the stomach in phosphorus, breathlessness of carbo-vegetabilis, constriction sensation of lachesis. These are four types of concomitant. Physical concomitant to mental emotions. For example, burning pain or burning between the scapula when a person is excited. Number 2, physical concomitant to physical pain. For example, during an asthmatic attack, the patient cannot tolerate light, or if the room is full of people, or he may have profuse perspiration with a weakness. Throbbing of vertex during an attack of asthma is another example. Mental concomitant to physical complaint. For example, suicidal feeling during pain or become a violent during pain. Mental concomitant to mental complaint. For example, grief with a depression, but she very much like to express herself and talk. Her loquacity is concomitant as it cannot be explained by the grief. Concomitant needs not always the general symptom. Sometimes they are particular in a part of the body but have no pathological base for this existence. My teacher successfully prescribed Agnus castus in the case of child with a molluscum contagious using the symptom itching of scalp when going to sleep.